Hello everybody. We are going to discuss today about the pharmacotherapy. Just a thought to ponder. If you just give a pharmacotherapy to a patient, is that going to suffice? No. Pharmacotherapy is going to sail you through the journey of your cessation. What is requisite is a behavioral therapy as well. So I am going to discuss today about tobacco cessation, about the pharmacotherapy, but that is not the all. You need to have a behavioral therapy as well, so as to sort out the knots in your mind, your thoughts in your mind about a tobacco cessation, about tobacco withdrawal, quitting, and all the aspects. So quickly coming back to our topic for today is a pharmacotherapy. You are stopping a source of nicotine, you need to replenish it with nicotine. So you have nicotine replacement therapies and you have non-nicotine replacement therapies. Nicotine replacement therapy is when you give is a nicotine patches, nicotine chewing gums, nicotine lozenges, nicotine inhalers. These are the ones which are going to help you tide over your withdrawals, your cravings. But this has to be given only for a period of 2 to 3 months, not beyond that. You have to start tapering those doses. So nicotine replacement therapy is recommended for almost every patient who wants to stop nicotine. But suppose if you don't want to take nicotine, patient is not able to adjust to the dosages that you give for nicotine, you have other option of using what is called as a non-nicotine replacement therapy, such as mainly today currently available are buprenorphine, and the second is a Champix, that is Varenicline. Remember, you can combine with nicotine replacement therapy buprenorphine, but you may not combine Varenicline with any of this. Buprenorphine is an antidepressant. So buprenorphine can be added to a nicotine replacement therapy and they will work in synergism. Varenicline has an effect exactly opposite to nicotine, so you need to stop nicotine or tobacco and then you start. Remember, all these drugs have to be started at least 2 weeks before you finally quit tobacco. The ways of quitting tobacco are two. One is a cold turkey technique, where you stop tobacco on day one, and the other is a gradual. Many people prefer a gradual therapy, the others people prefer a cold turkey. A gradual therapy is what we start with for when we start with buprenorphine or Varenicline, and we start at least 2 weeks and then we start tapering it off the dose. Varenicline is going to act, what we call Champix is going to work on it's an agonist, it's a partial agonist, but it's going to prevent the pleasure effects that you get from taking nicotine, and thereby you are going to reduce your tobacco intake or stop altogether. So these are the 3 or 4 modalities available. What are other modalities which can be used apart from this? These are the ones which are commonly used, but there can be something like a serotonin receptor antagonist, or you use nortriptyline. There are other various agents which are also in the pipeline. Apart from that, what you also have a certain magnetic resonance therapy, magnetic resonance where the rays are given to a nucleus ambiguous, and it's a transcranial magnetic resonance therapy where you are bombarded with particular rays which are directed towards that particular zone, that is nucleus ambiguous, which is then going to prevent you from taking a nicotine. So lot of agents are still in pipeline, they are getting investigated, but in today's current scenario, it's all about nicotine replacement in the form of nicotine chewing gums, nicotine other agents, or it could be buprenorphine or Varenicline or combination of either of that except for Varenicline. This is what it takes. You need to take this particular medicines, you need to take all this, you need to go through this journey which is very difficult for a person who is addicted, heavily addicted, taking more than 40-50 cigarettes a day or eating more than 40-50 times a day Such is a problem. You have to spend money on your nicotine replacement, nicotine, non-nicotine therapies. They have their own side effects. They have their own, I would say, emotional effect, a connect to the patient. Why to have all this? You should quit tobacco. You should stop taking. If you have stopped taking tobacco, or if you have not started, please do not think about taking tobacco, because tobacco is a knife that cuts the life. Thank you so much.